Welcome to a How To Corner, and my name is Will Gray. I'm your neighborhood physical therapist. And today episode, we're going to talk about ankle sprains, symptoms, types, and treatments. Before we get started, please like, share, subscribe, follow, comment, leave questions in the comment that you would like for us to answer, and we'll definitely answer them. With that being said, let's get going. So the agenda for today's talk is the anatomy of the ankle, causes of ankle sprains, types of ankle sprains, severity grades, symptoms, diagnosis, treatment, rehabilitation, prevention tips, and possible complications from ankle sprain. Now, the anatomy of the ankle itself is pretty simple. You have your tib, your fib, as well as your talus, and they create the joint for the ankle. Now, you have multiple ligaments. You have your anterior talofibular ligaments, you have your posterior talofibular ligaments, and you have your deltoid ligaments medially. You have your calcaneofibular ligament also, and those ligaments are ligaments that just surround the ankle. They function to stabilize the ankle and prevent excessive movement. Somewhat. They pretty much keep things connected. The muscles themselves in the ankles are what really prevent that excessive movement, and as a result, when you sprain your ankle, you have to be very, very aware of which ligaments involved in order to help with your recovery as quick as possible. Now, let's talk about the causes of ankle sprains. Sudden twisting or rolling of the ankle, uneven surface or improper footwear, landing awkwardly after jumping, weak ankle and leg muscles. These are some of the basic causes of ankle sprains. There are also some mechanisms of injuries when you land and you have an inversion roll or an outward roll of the ankle, like you see in this picture, or when you play in a sport and you plant and your shoe does not stabilize. In addition to that, it just slides from underneath you and you have a roll. And like I say, also, you have people who can step on your ankle and so on and so forth. Now, the types of ankle sprains. You have inversion, eversion, high ankle sprain. Now, an inversion sprain is what I said, a lateral sprain when your foot rolls inward. That's the most common. Eversion sprains, medial sprain, foot rolls outward, which is also how the mechanism of injury occurs for the high ankle sprain, which is an injury to the ligaments connecting the tibia and the fibula, and it's basically your interosseous ligaments, or that particular fascia that's between those two bones. So that eversion with that rotation, with somebody, so with some loaded weight on you, causes that sprain to happen. An inverted sprain, you can just step off a step and roll your ankle. Now, grades of sprains. You have grade 1, 2, and 3. Grade 1 is mild, just stretched ligaments, slight pain, minimal swelling. You usually can recover from those pretty quickly. Grade 2 is moderate, partial tear of the actual ligaments in your ankle, pain, swelling, bruising, limited motion. Severe is complete rupturing, which then you have severe pain, instability, difficulty, weight bearing on your ankle, and all those can be treated totally different. Now, let's talk about some more symptoms with the ankle sprain once it occurs. Pain and swelling around the ankle, as you see in this picture, top left, as well as bruising and stiffness, difficulty walking or balancing, and you have a popping sound or sensation at the injury site itself. In short, when you roll your ankle, you can pretty much tell pretty quickly if you have an ankle sprain just by these common symptoms that you see with an ankle sprain. They're very classical. How do you diagnose them? Simple. You can check all of the actual points of pain through palpation. Look at the range of motion, see if there's any bruising or swelling. They do imaging and stuff, but that imaging is mostly just to verify if there's any type of actual fractures. When you're doing that imaging, like an X-ray, MRI, it's to detect any ligament or soft tissue damage. If you're having a chronic issue, not being able to recover from the ankle sprain, or you're having consistent pain. Now, rehabilitation and recovery. Phase one, you're trying to reduce the actual swelling as much as possible and reestablish the range of motion actually in phase one. Phase two, you're really trying to get your active range of motion going because you want to be able to move more of your ankle on your own. And then from there, we progress to three, which is strengthening and balancing. Trying to be able to weight bear again, as well as build up those muscles that surround the ankle in order to be able to have stability, and then gradual return to activity or sports. There's some little bit of some other stuff within between that we didn't really speak on just now, but there are some specifics that you have to get to before you get to the gradual activity return to sport. And the average recovery time, 1 to 2 weeks for a mild, moderate 3 to 6 weeks, and severe could be 8+ weeks. So it all depends on the nature of the ligaments involved. Let's talk about some prevention and tips. You can warm up for physical activity. That helps you to basically have muscle activation so you can have some better performance of your muscles doing these activities when you're planting or pivoting or trying to perform. Strengthen the ankle and leg muscles, just having more strength through your leg and ankle muscles, as well as your hip muscles too, help to be able to give you better stability at the ankle. So when you have a roll that occurs, you have some resiliency there. And then just figuring out your shoe wear or your proper shoes for the sport you're playing in, what works for you, and then use ankle braces or tape for extra support. That usually is a standard for most athletes who are playing sports. But if you're not an athlete, you can put a brace on and that'll help you. And then last but not least, just working on your balance and your coordination. That will really help to avoid a lot of ankle sprains. Now, last but not least, I wanted to touch on some possible complications. You can have a chronic issue with your ankle when it comes to instability, right? So if you had an ankle sprain and you sprain your ankle multiple times and you haven't let the ankle heal over time, what happens? You have instability because those ligaments are basically really so stretched out or they're so damaged that they don't help with stability. And stability of most joints come in three types of situations. You have the congruency of the joint, how the joint fits together, the talus and the actual tibia, and then you have the ligaments, which keep those bones together, and then the muscles, which are your dynamic stabilizers, which then allow you to move with stability. Now, in addition to this, if you have multiple ankle sprains, you can get to the point where you have joint stiffness or arthritis that develops there just due to the chronic inflammation of the area and injury to the area, and then ligament tendon damage, which is basically chronic non-healing ligaments and tendons in your ankles, and that is basically when you get to a point where you sprain your ankle so many times that your ligaments themselves just are really, really, really not in a good health in order for them to recover. Now, if you enjoyed the talk today, you can also reach out to us on different platforms that we have. We're on Facebook, TikTok, Instagram. Just literally type in 3Gen Physical Therapy. If you want to come to our website and send us a contact through there, you can go to our contact page and that'll work also. And with that being said, I hope you have a great one. I'll catch you in the next one. Thank you.